Hey everyone, welcome. I am Dr. Lauren from Novo Chiropractic, and I want to welcome you all to our webinar this evening on the perfect storm. This is a workshop for parents and providers, and it is all about the alphabet soup diagnoses, things like ADHD, autism spectrum disorder, sensory processing disorders, as well as anxiety. And this is usually done as a in-person workshop. However, I know it is a really busy season with the holidays approaching, and with the weather this evening, the crazy cold we are having, I wanted to allow everyone to join from home this evening. And I really want to respect your time this evening, so we're going to jump right into the information. I'm going to go ahead and try to share my screen with you all. Okay, and so like I mentioned, tonight we are going to be talking about the perfect storm. Perfect storm is a lot of the science and the neurology behind a lot of the symptoms that these kids are having, and it's also going to be some answers and some hope. And so like I mentioned, we're going to talk about awareness, we're going to talk about answers, and then we're going to go over some action steps for all of you who are joining us this evening to help some of these kids that are struggling with these various symptoms. So like I mentioned initially, my name is Dr. Lawrence Rust. I am the owner and the chiropractor at Novo Chiropractic. We are located in Hopkins, and when I completed my undergrad studies, I was down at MSU Mankato, where I played Division I ice hockey. And I mention that because it's really a part of how I became a chiropractor. I'm going to cover that a little bit on the next slide, but that's why I mentioned that. When I completed my Doctor of Chiropractic Studies, that was done at Northwestern Health Sciences University, which is located in Bloomington, Minnesota. So I was really lucky that there is a chiropractic college fairly close to home. And then lastly, on the bottom there, you can see that I'm a pediatric trained chiropractor. Some of you may be familiar with those various organizations and certifications, and some of you may not be. The International Chiropractic Pediatric Association is responsible for extra training and extra certification surrounding the specialized population of pediatrics. So extra training working with babies that are as young as a day old. And then the Webster certification is utilized for pregnant women. It is a technique used to balance the pelvis, and it helps to decrease what we call intrauterine constraint. When the pelvis is balanced, it helps to allow for optimum fetal positioning, and so ideally baby has more room to get head down. And so that's what Webster certification is. A little bit more surrounding my why and how I became a chiropractor. I mentioned that I played hockey down at MSU Mankato, and while I was playing hockey, unfortunately I suffered an injury. I took a fall and went into the boards, and I ended up herniating my L4, L5 disc. So I have a disc herniation. And while I was down at school, I was really put through the ringer as far as different medical interventions. Things like various injections, various prescription medications, physical therapy, and they were even considering me for a experimental disc replacement surgery at the time. And having not grown up in a chiropractic family, chiropractic was not my first choice of treatment, but someone ended up mentioning it. And I tried it, I got adjusted, and it really blew everything else out of the water in terms of symptom relief, my ability to move, to continue playing hockey, range of motion, and those types of things. And so that experience is really what led me to become a chiropractor. And I changed from a pre-physical therapy major to a pre-chiropractic major at the time. And so when I showed up to chiropractic school, I was there and I was ready to learn about how great chiropractic care is for neck and low back pain. And don't get me wrong, it is fantastic for those things, but there's so much more to it. And that's really what is encompassing this picture on your right here. And once I progressed in the program, we were getting more into specialized populations, and one of those being pediatric populations. And so I saw the way that these kids were having great results with some really debilitating conditions, and I knew right then that I wanted to become a pediatric chiropractor. And so that's led me to where I am today. So just a little bit about me and about my why and how Novo Chiropractic came to be. And so we're going to jump, like I said, right into the information. Some of the things that we talk about tonight is going to be things that maybe a lot of you know a fair amount about, or even know a lot about. This is something that many of you may have been researching for years and talking with other professionals about, consulting other professionals, and you may feel that you're really well versed in this topic. But the difference between those other times and tonight is going to be that tonight you're going to be viewing that information through a different lens. And I will touch on that more. I first want you to just watch this quick, about a minute video. For those of you who are joining us live, it should be perfect speed. But for those of you who may be watching this on a recording, I think it does lag about a second or two. You should still be able to follow the video, but just so you're aware, there is a little bit of a lag there.
This is an awareness test. How many passes does the team in white make? Go! The answer is 13. But did you see the moonwalking bear? Go!
And so just like the video states, it's really easy to miss something that you're not looking for. And so that's what I was referring to when I was talking about seeing this topic through a different lens this evening. That's how we're going to be addressing this information. And we all know that there are no two diagnoses that are the same. There's no two same autism diagnoses or ADHD. Every child is different, and therefore every diagnosis is different. However, for the sake of tonight's conversation, we are going to say that all of these kids with these different alphabet soup diagnoses fall under the same umbrella. And what that umbrella is really going to be a wound up, stressed out, too tight, locked down nervous system. And what we see with that is oftentimes these kids, by the time we see them in the office, they're exhibiting some of these neurological symptoms. And this is obviously really, really a serious thing. And so parents and professionals are concerned with helping to address these now symptoms, things that are like sensory processing and speech problems. And so everyone is focused on addressing these issues that these kiddos are currently having. And however, the problem is that not many people step back and say, okay, why did these conditions start in the first place? And so as a doctor of chiropractic, our title is DC. And somebody once told me that that means doctor of cause. And so as a chiropractor, my job is to look at what's currently going on and really backtrack to what could have caused this so that we can alter the results and alter the current problems and symptoms that are going on. And so tonight, step one, like I mentioned, is going to be to give you the science and the neurology behind the perfect storm. And then step two is going to be giving you some action steps. And these are going to be things that you can do to help these kiddos. And they're going to be things that I guarantee you haven't done prior to this talk tonight. So let's go ahead and move on. And so we've mentioned the perfect storm. Now, what is the perfect storm? The perfect storm is not a talk about genetics. That's not the conversation we're having tonight. Your kids weren't dealt a bad deck of cards. If it was genetics, this is something that happens over thousands of years. We don't go from 1 in 2,000 kids diagnosed with autism 2 generations ago to now more than 1 in 50 kids diagnosed with autism in, like I said, in just 2 generations. That's something that takes many, many generations. And so there's something more going on here. And so what is that? Number one is fertility and pregnancy challenges. So we know that fertility challenges have a higher incidence of neurosensory issues later in life for kiddos that are a result of that. We also know that pregnancy and stress during pregnancy plays a role. So for instance, in a fetus, the brain and the nervous system are the first areas to develop. And if mom is very stressed out, baby is pre-wired for stress. And so we know that nerves that fire together wire together. And so this is why you've heard in the past doctors or other health professionals talking about mom managing stress in pregnancy. The baby's brain and nervous system quite literally mimics what the mom is going through. And so if the mom is very stressed out and on edge, a lot of times baby is pre-wired for that stress. Number two is intervention and injury, ultimately injury, during labor and delivery. And so this is really the one that we are going to talk about big time tonight. This is what I call the 80%. This is about 80% of these perfect storm kiddos that we see in our practice and very similar practices to ours. This is what a lot of their issues are stemming from. And so this is also the reason why you may wonder why a chiropractor is having this conversation. And this is exactly why, because the most commonly injured area during labor and delivery is the head and the spine. And so don't get me wrong, this is a really necessary way for these kids to come into this world. Perhaps it was the safest way for baby and ultimately as well the safest way for mom, but nonetheless it can be very stressful and there can be injury associated, and so we need to address those things. And so number one and number two really set up a domino effect for the remaining cascade here. And so a very stressful fertility and pregnancy journey leading to a stressful birth often result in a stressed or a colicky baby. A colicky baby is just kind of another term for a really stressed out baby. Their nervous system is so stressed out and so wound up and so on edge that oftentimes they can't figure out how to relax enough to latch and feed appropriately. They end up gulping air. They have a belly full of gas. They're uncomfortable. They're crying, those types of things. A colicky baby then turns into things like a stressed and a sick infant and toddler. And these are the kids that we're seeing with chronic ear infections, chronic upper respiratory infections, those types of things. All these things that we are told, oh, they will grow out of. And so, but what we find is that these kids don't necessarily grow out of these challenges, but they grow into sensory issues and speech issues and social disconnections and those types of things. And so we know a stressed out and a wound up baby, they don't stop being stressed at maybe their 4th birthday. It's just now termed something else. And so with these kids who are stressed out, they're stuck in what we call sympathetic overdrive. And we'll talk about that, but they're so stressed out and they're unable to process all this incoming information. It's very overwhelming to them, and they need a way to help flip this switch to turn off this stress. And that's what we're talking about here. Like I said, the sensory and the spectrum, the stuck child. And so this is a comparison that we use to talk about that sympathetic overdrive. If you are looking at the chart in the 7, 8, 9, and 10, the maroon color there, that's where a lot of these kids' nervous system hangs out. And that's what we call sympathetic overdrive. That is your fight or flight response. It's always on edge. It's really good if someone's chasing you or something along those lines, but you want to be able to tap into it and then come back to somewhere around that 4, 5, 6 area. A lot of these kids with these alphabet soup diagnoses are really hanging out in that 7, 8, 9, 10 area throughout their day. And so something small that would send me or you into a little bit of a stress response really sends them over the edge, and they need a way to relieve all that extra energy excuse me, and stress. And so oftentimes we see behavior, because behavior is a way of letting off all of that stress. So in these kids, we need a way to bring them back to midline. And so what's on the opposite level of the spectrum there is 0, 1, 2, and 3. That is what we call the parasympathetic response. This is what you can call the brake pedal. And it's responsible for things like resting and relaxing and digestion and immune function. And because a lot of these kids are hanging out on the opposite side of the spectrum, that's why we obviously know that these kids are not very good at relaxing. They don't sleep very well. Oftentimes they have compromised immune systems, so recurrent sickness, those types of things. And so we need a way to take this sympathetic overdrive and activate the parasympathetics. And so we'll talk about the way that we do that. One of the ways that we do that is via the vagus nerve. And the vagus nerve is the most parasympathetic nerve in the body. And so I tell you that for two different reasons. Number one, as a chiropractor, this is the nerve that we are accessing. It starts in the head, it comes out just below the base of the skull and the neck and goes down into your thorax. It is responsible, it's essentially the brake pedal. And so, like I said, as a chiropractor, this is the nerve that we're working with in a lot of these kids, helping to stimulate it via adjustments to tap into the brake pedal. The other reason that I tell you the location of the vagus nerve is because in just a couple minutes, we are going to watch a short clip of a cesarean section birth. And I want you to keep in mind the location of that nerve in the upper neck as we watch that. But jumping into this quote here by Dr. Bruce Lipton, the function of the nervous system is to perceive the environment and to coordinate the behavior of all the other cells. And so as a parent or as a professional working with kids that have these challenges, there's probably one of those bold words there that really stands out to you. And my guess is that it's the word behavior. And so when these kids are working with a lot of other great professionals, things like speech therapists and PTs and OTs, they're working with that bold word coordination there. So we have input, we have processing, and we have output. And a lot of these professionals are working with the processing aspect in these kids. However, the problem is that if we're working with the processing aspect, we can only make so much of an impact in that area if the input, the perception of these kids is very overwhelmed. And so what chiropractic does is we focus on the input, trying to calm things down so that these kids can process things better and easier. We live our lives through our nervous system, so making sure that our nervous system is well balanced is really important for all other aspects of our life. And you can see an example of that here with what we call the neuro fuse box chart. And so what we're referencing is on the left side of the spine, you can kind of see the area that would be related to input, the area of the spine. And then in the middle, you can see the areas that are processing, and then the output on the far right side. And so for instance, you can see how maybe a problem at T6 where the input is, all the way to the right will lead to stomach symptoms appearing. And so the idea behind chiropractic is that we have 31 pairs of spinal nerves within our body. And say, for instance, there's a problem with one of those nerves, there's a miscommunication. And if there's a miscommunication, it can lead to symptoms. So for instance, there's a problem from the T6 nerve going to the stomach. If there's that miscommunication, we can see stomach symptoms. The idea behind chiropractic is that we take that misalignment or that problem and remove it so that the body can function the way that it's intended so that those symptoms resolve. And you can kind of see that exemplified here in the neuro fuse box chart. You have probably heard me use the word subluxation or miscommunication. It is a chiropractor's term for stress stuck on the nervous system. And so this is something that we are trying to remove so that, like I said, the input and the processing is not so overwhelmed in these kids. I'm going to quick address the 3 T's. Many of you who have kids that are struggling with these diagnoses, or you're a professional working with kids with these diagnoses, you're already familiar with these. But in chiropractic, we talk about the 3 T's. We talk about thoughts, traumas, and toxins. There are 3 different avenues that put stress on our nervous system. When our nervous system is stressed, we see a lot of these symptoms come into play. And so limiting these thoughts, traumas, and toxins is really important. When we're talking about fear and anxiety, we're talking about things that are obviously really rampant in today's lifestyle. Everyone is always go, 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 stressed about work, stressed about school, what do I have yet to get done, those types of things. And that can really send us into a consistent stress response. That leads into things like a busy lifestyle. And for these kids, oftentimes tech overload. And so it really should be thoughts, traumas, toxins, and tech in today's world. Many of these kids spend more time staring at their phone or at a laptop than they do not. And so tech can be very overwhelming to the brain and the nervous system. So limiting that is often very helpful. And these things can lead to things like impulsive behavior and social challenges. When we're talking about traumas in the middle there, it's really that domino effect of the perfect storm we're talking about. It's a stressful pregnancy leading to a stressful birth, potentially birth injury, and then obviously a lot of the physical stress that comes with childhood, so falls and accidents. And then lastly is toxins, so things like chronic consistent antibiotic use, a poor diet, so high processed foods, fast foods, high sugar, those things, as well as high doses of medication or consistent medication, as well as environmental toxins. And so in the next section, we're really going to dive into the science and the neurology aspect of the perfect storm. I've kind of given you an introduction and explained it, but we're going to talk about the actual science behind it, and how oftentimes that birth trauma directly leads to these symptoms these kids are experiencing. And so the first word we are going to talk about is dyskinesia. And so when I say dyskinesia, it really just means abnormal alignment and abnormal motion. And so like I mentioned, the injury to maybe one of the 31 pairs of the spinal nerves, if there is a misalignment causing a miscommunication between the nerve and its organ or structure, then we're going to see symptoms. And so chiropractic focuses on removing that miscommunication. And so unfortunately, that's really where a lot of chiropractors' philosophy ends. And there's been studies more recently about how it's not necessarily the misalignment itself that causes the symptoms, but it's more so the fixation, the lack of motion. Every individual vertebrae in this spine has the ability to move. It lets us do things like lean over and twist. And so when there is a misalignment, the fixation or the movement is also affected. And so our brain is not getting the proper proprioception from this movement of the vertebrae like this that we should. And that's what causes a lot of the symptoms, is that it gives our brain bad information. And we'll talk about that a little bit more here as well. And so I do have to preface this video quick before we see it. It's only about 30 seconds long. It's not too graphic, but I do show it for a couple reasons. You may wonder, okay, so if this is something from the birth trauma, or you talk about the dyskinesia that needs to be there, how did this happen? Where would this have occurred in my child? And this is really where it could begin. This is a normal cesarean section, not an emergency C-section. I want to have you keep a couple things in the back of your mind when you're listening to this, is for sure just where the location of that vagus nerve is, as well as just watching the baby's neck. We know that the vagus nerve is at the top of the neck. And so go ahead and just watch this video.
Oh, there you go. Come on, buddy. All right. Ears of a girl. Ears of a girl. Make you cute for the camera. Oh, man. Keep coming back. There you go.
Okay. And so with this, I show this for a couple different reasons. Obviously, we talk about where that fixation may come from, and this is really where it can begin, and a lot of times it does begin. And you don't need to be a doctor, you don't need to be a chiropractor or a specialist to know that this is probably not a good way to manage a baby's head. We know that their brain and their nervous system is really the most important things, and that they are not able to protect those areas. And I don't say that in coming from a bad way towards these OBs. A lot of times, like we mentioned, these C-sections are something that are needed in order for these children to come into this world. But it's almost more of a miscommunication. And what I mean by that is these OBs will deliver a baby, and they will literally and figuratively wash their hands of the birth. The baby's here, they're alive, they're doing okay, they're done with it. That's their role in the birth. The child grows up and they are having this chronic stress response. They're constantly sick. As they get a little bit older, they're starting to be diagnosed with some alphabet soup diagnoses, whether it's sensory issues they're exhibiting or behavioral issues. Parents end up taking the child to the pediatrician, and the pediatrician looks back and says, nope, it was a normal cesarean section. There's no evidence of birth trauma. And so we don't know, there's no correlation between the birth and their current symptoms. However, we know that this is some form of birth trauma, and this can cause some neurological issues. And so that's what we're talking about here. Especially because, like we mentioned, that was a normal cesarean birth. And you can see in the mid-70s, the cesarean birth rate was between 5 and 10%. And that's what's recommended by the WHO, the World Health Organization. And you can see now in more recent times that it's upwards of 33% of births are by cesarean section. And so we have more kids that are having their nervous systems and their spines treated like this, and so we are oftentimes seeing more incidences of these alphabet soup diagnoses. In a recent study done by osteopaths, they actually did an examination. This was in Australia. They examined 100 infants and found that 99 of them had these subluxations after birth. And we also saw that the longer the delivery was and the greater the intervention, it led to more severity in these subluxations. And so we know that being these areas that are stuck and not moving, it leads to altered brain development, which starts the perfect storm cascade. And so disafferentation is the next D word we're going to talk about. And this is referring to incoming information from the brain. And so the brain is always perceiving information, and once the spine is stuck and not moving, it causes disafferentation, so bad input, basically. And that bad input is termed as nociception. Normal input is termed proprioception. And so if those individual segments are moving the way they should, the brain is receiving good information, it is proprioception. If they are receiving noise, it is nociception. And so we also know that 60% of our proprioception comes from the spine, and 33% alone just comes from the upper neck. So these areas that are often implicated in things like cesarean sections. So really important to keep in mind. The next word that we talk about is dysautonomia. And so we talked about this earlier with the chart, the 0 to 10, and then the needle going to the sympathetic or the parasympathetic side. And what's important here is this quote kind of defines it. You can't be in both growth and protection at the same time. And so if you are in fight or flight, you are in protection mode. And so these kids are really engaged in their fight or flight response. They can't access this growth side as well. They can't access the growth, the immune function, the rest, the recovery that they should be. And so a lot of times we're seeing things like behaviors because they're stuck in stress mode and they need to blow off steam. We're seeing kids who are immune challenged because they can't tap into that immune, that rest, and that recovery. And so, like I mentioned, the way that we do that is via the vagus nerve. The vagus nerve is the most parasympathetic nerve in the body. And so by stimulating it, it helps to take these kids off the gas pedal and activate the brake pedal a little bit more. And then the fourth D is dysphonesis. It is another word, or just the D word, for meaning energy. It is abnormal energy input. These kids are hanging around at that 9 or 10 on that scale. Something sends them over the edge. The nervous system is overwhelmed. They're overwhelmed. They don't mean to have these behaviors and act out, but the nervous system in the body needs a way to get rid of this extra energy. And so this is a way to do it, is through behaviors. And then the fifth D is disconnected. It's a result of the other 4 Ds that we talked about, those kids with that cascade and these issues. It's really leading to a disconnected and a struggling child. And so in our office, well, this is now the point that we talk about ways to help your child. And so there's 3 main categories of perfect storm type kids that we see. And in our office, we assess this via scans, which I'll talk about in just a little bit. But I'm going to first introduce you to the 3 types of perfect storm kids that we see. Number 1 is a raging bull kiddo. And these are the kids that have very high impulsivity. They are constantly having behaviors and breakdowns. They struggle going into public. Oftentimes they're struggling in school with outbursts and those types of things. We have kids who are a drunken bull. And a drunken bull kid is a kid who struggles with focus. They also have decreased motor control. They're often termed as unathletic or kind of clumsy. We see them sit in a chair and they have low muscle tone and low core tone. So oftentimes they sit and they hunch over and they almost fold over themselves because they don't have that muscle core tone that's needed. And then by far and away, the most common one is the raging drunken bull. And that's a combination of the above 2. So sometimes we see behaviors and a very impulsive child. And sometimes we see a kid who really struggles with focus and just is frustrated and kind of uncoordinated. And so like I mentioned, we do scans in our office. And the scans they're sensory scans. They don't put anything into the child. They're just retrieving the information from the child. They measure 3 things, and those things are thermography, electromyography, and HRV. And if your child were to come into the office, I would feel very confident that I could put my hands on your child's neck and feel the areas of misalignment or the areas that there is a problem. However, we obviously need to quantify that neurodysfunction, and so we use the scans to do it. And so the scans tell us basically how bad things are, how long they've been there, where they're located. It's a really good objective measurement of where things are and what's going on in the area, so we can figure out a way to fix it. And that's something that really sets our office apart from other offices who are more symptom-based. Our technique is focusing on this neuroplasticity and measuring more long-term changes for these kids. And so the next section, I'm just going to go through a few scans with all of you. These are kids that are under our care or have been under our care and have seen some awesome results. And this just shows you what the different types of perfect storm kids look like via our scans. And so this first one is a thermography scan. This is, like I said, one of the 3 scans. And this is 3-year-old Ellie. She is a classic drunken bull, so struggles with focus, anxiety, kind of clumsy, those types of things, was having a lot of sensory issues. And so you can see it's important for you to know that the white is considered a normal reading. The red is something major going on at that level, and the green or blue is somewhere in between. And so I want you to focus on the levels of C1 and C2. You can see there's a large red bar going one direction and then another large bar going the other direction in that upper cervical spine. And what we call that is counter rotation. And unfortunately, a lot of times I can determine how the birth went for these children based off of their scans. And so for instance, Ellie was a cesarean section birth. And I know this because when the children are lifted up, they often are twisted out as well. And so like we mentioned, each vertebrae moves on the vertebrae above and below it. And so we see this counter rotation because we're lifting and then the very top vertebrae in the neck is being twisted and it stays there. And so there's a major miscommunication going up at C1 and C2. And we see that, like I said, with cesarean section births. And so that's an example of Ellie. She's been with us for about a month. She's starting to do a lot better. Some of those sensory changes are starting to resolve. Anxiety is down a little bit. And so in just a month, we're starting to see a lot of symptom improvement, which is huge, especially for these kids struggling. And so this next one is Declan. This is an EMG scan, and EMG is measuring the muscle and the energy output throughout the system. You can see on the left, that's an initial scan. On the right, this is his 3-month scan. And Declan is essentially, this is a nervous system who we would say is like front row at a Metallica concert. This is loud and blown out and can't relax. Declan was a kid who his parents were having meetings with his teacher because he was struggling to stay focused and to not disrupt the class. So there was talks about pulling him from class. There was constant tantrums. He's really what we would call a raging bull. And so again, you can see on the left, all of the red, all of the blue, and all of the green going on. So there's just a lot going on in his initial scans. Like I said, on the right, that's his 3-month scan. So a lot of that is starting to calm down. We're starting to see decreases as well in his symptoms. He's able to sit through a normal class period without being disruptive. There's no more talk of him being pulled from class, which is obviously life-changing for him. And so, like I said, this is classic raging bull, and Ellie was classic drunken bull. The next one we have here, and the reason I put this in is sometimes I will have conversations with parents and do this talk, and people are like, I had a home birth. I didn't have a traumatic birth. I didn't have a traumatic pregnancy. So what you're talking about with the C-sections or the birth injury, it doesn't pertain to me. And this is the example that I use for that. This is 11-year-old Avery. She's a cheerleader. She was a home birth, and so she didn't have a lot of those challenges. But what you do see here is the arrows pointing to the area of the T10 to T12 region. And the really important organ in that area is our adrenal glands. Our adrenal glands house our stress response hormones. And so things like epinephrine, norepinephrine, cortisol are housed there. Like I mentioned, Avery is a cheerleader. She sustained a back injury, and that injury led to a miscommunication to the areas of T10 to T12. So her adrenal organs and glands are flaring up. They're not functioning the way that they should. And so it kicks her into a stress response similar to what we see from a lot of these birth injuries. However, it's not quite as hairy as those ones that we see with the cervical injury. And the other thing that I want to point out with Avery's scan here is you can see on the bottom it says total energy is 210. Our ideal energy for these kids is closer to 100. And so if I switch to the next screen, you can see that her original scans are there on the left. Her follow-up scans for 3 months are on the right, and that her total energy is down to 123. So she's not having a lot of these stress-based symptoms that she was having. That T10 to T12 area is now white, which we said is normal. And on the bottom, you don't see that giant spike in the graph. And so addressing, it's not just these cervical areas that we're addressing, it's different areas such as the adrenal glands that can lead to these responses in these kids. And for those parents and those professionals who don't have experience in chiropractic, maybe they've never seen a chiropractor themselves, or they've never taken their child to a chiropractor, I'm often asked, what are the 4 most common effects that you see? Are there side effects even? And this is often what I talk about. And so number 1 is calm. Like you saw in some of the scans, we're taking the energy and we are condensing it. We're calming it down so that it's that input, so that these kids can better manage their processing when the input is calm. They're not so overwhelmed. We see control. We see better control in those drunken bull kids. They start to be able to develop proper muscle control when their brain isn't so overwhelmed with nociception all the time. We see that proper proprioception is starting to come into play. When the input is calmed down, they have that ability to start to make connections, connections with speech, connections with sensory issues, resolving those types of things. And then ultimately coordination. When the input is calm and they're able to do processing, the output, which is the coordination, improves. So those are the 4 most common effects that we see in these alphabet soup diagnoses kids with chiropractic care. And so then here are the action steps. These are things that that you can do. And so number 1 is do what you did tonight, is to show up to never stop asking questions and seeking answers and finding professionals and advocating for your kid. And so number one is really, like I said, what you did tonight. Number two is reducing the 3 T's that we talked about. It helps with the gas and the brake form. And so it helps to, if you're not doing them already at home, this is something you should be doing. These are immediate action steps that are going to help some of these kids be able to handle these current symptoms a lot better than what they are right now. And then the third one is to get your child scanned. We talked about the various scans that we do in our office that set our office apart from other offices. These scans are an objective measurement that help us to find that neurodysfunction so that we can tell you how long it's been there and how to fix it. And so how it works is this. We know that oftentimes these kids with these challenges don't do well with long, drawn-out appointments. And so in our office, the new patient appointments are split into 2 days. On day 1, you come in and we listen to your birth story, your child's health history. They get the 3 different scans performed on them, and we have a hands-on evaluation. And that's it for day number 1. We take 24 to 48 hours to process through all the information because every care plan and all the steps are so personalized. Then you come back with your kid. You see these are the results of the scans. These are the problem areas. This is how we fix them, and this is how much it's going to cost. On that day, if you decide to embark on care, then your child can receive their adjustment on that first day. And so everything we do is really, like I said, really personalized and really designed to make it easy on these kids that are currently having so many challenges. And because I know how hard it is to watch your child struggle and to have your child struggling, our new patient appointment is generally $98. If you mention the Perfect Storm workshop, that rate is reduced to $49. I feel that strongly about getting these kids scanned and about the results that they see. So if you think that this is a conversation pertaining to your child or someone you know, please call the office and get your child scanned so that we can see what's going on and how we can provide them some help and some care. And so then lastly, if you have any questions, feel free to reach out, contact the office, contact me directly via email. I'd be happy to answer them. I want to thank you all for taking the time this evening to join us for our webinar. We will have upcoming workshops. Like I mentioned, they are usually done in person. So if you wish to attend an in-person workshop, we'd be happy to have you. And again, if this is something that your child is struggling with, I really encourage you to get them scanned and be sure to mention the Perfect Storm webinar price so that you get that discount as well. Take care, everyone.